All right. Interview with a peacock.
Yeah, because I had to change the camera angle because my stuff was in the way.
Okay, so I want to ask you more questions, and I'll try and speak a little louder this time. So we were just talking before we were filming, and so we decided we better turn this thing on because we'll just end up. So none of these questions are practiced. I had, after watching the video that we made the other day, I had the idea of talking about. I don't know if people caught it on the last video that I'm a nurse. That was how I was thinking about how long we've known each other now. Is it like a year and a half?
I met you and you came out, the last time you were out was what, February, January of last year?
We communicated for a long time.
Yeah.
Before that, because it became obvious to me that some of the comments you made on your videos could only be made by somebody who knows healthcare and understands it really well.
Well, can I just say too that when people make comments that like I'm not a nurse or yeah, right. That's funny.
That's why
I don't even. It's look upable.
And so I want to
freaking idiot. Like,
you
know what I mean?
And I've seen,
look it up. The first thing I did when you told me you were a nurse is I went and I verified your licenses. Like, if you know, you know. And so, you know, trolls in the comment section, talk about something else because.
Well, so no, but I mean, yeah. So I'll comment to that, even if you won't. That so I've been a nurse I'm going on 30 years, and nurse in a lot of different capacities, whether it's home health care, med surge, float in a hospital. Let's see, I worked in corrections. My point is, so I've been around, and I can assure anybody who wants to challenge whether or not Angie's a nurse that, like I said, I could tell from just random comments on some videos that you were a nurse, because despite what people think about healthcare these days, apparently, everybody on the internet believes all you do is watch a couple videos and suddenly you're a professional. They're actually, it's easy to spot a professional and somebody who's not a professional. So that became intriguing because, like we discussed in the previous video, that you have this history that falls in line with not being out here. So that's where I want to go today. I want to go down the nursing thing in a little different way, because I think it's a really interesting question about what went wrong from the time I was in nursing school and the time you were in nursing school, and how that followed, to you having a really difficult time economically and me not having that time. And so I'll start out with the question just at the beginning about school. So when I went to nursing school, I'd already I'd been in and out of college, and then I went to music school. And after playing music for a long time, I realized I needed to have a career, and it was just kind of by accident. I was already working as a CNA. So I was able to go back to school, get into a program, and basically pay for that out of pocket. So basically it took about 3.5 years for me to go back, get the basics done, biology, chemistry, and things like that, get into the nursing program, pay for the nursing program. I was able to work. And so I'll hand it off to you. Like, what was how did the school part of it work for you?
So I already had 2 kids. Or I had 1 kid at the time. Anyway, I wanted to go back to school, and the only way to do it, in my opinion, the community college, which was cheaper, I think it was like $10,000 for the nursing program, they pulled you off of a lottery list of people that were trying to get into the program. Yeah. Okay, well, versus the private college, Kaiser University, the one that I ended up going to, which was $30,000 for the program, where if you can pass the test, and by the way, we have an opening. So if you showed up to talk to the counselor today and you sit for your test today and you pass it, you could start nursing by, the next semester. So without studying, I took the entrance tests. I passed with flying colors and ended up at the private college. I didn't have the ability because I already had my family started. I didn't have and was not living with my family anymore. I didn't have the ability to just wait for some random long lottery list that I might not get called on for years and years and years. I had to, if I was going to quit the job that I was working, I needed a guaranteed, you will be done by this date as long as you don't screw up. You know what I mean?
And so how did that work? Were there any, as far as like student loan stuff, were you able to get any grants or anything like that?
I think I got the Pell Grant.
Okay.
But it was $30,000 for the program, and then I took out a student answer loan, which my mom co-signed on, and I ended up defaulting on that loan when I bugged out and moved to the desert. Sorry, Mom. But
and that was it. But that's a really important point that we're going to come back to some. But just as a snippet here, because this is where I'm going with this, that was after you defaulted on that loan. That was after how long of being a nurse?
Almost 10 years.
Okay.
10 years. And we're talking about just for the RN, right? Because then I went back to Florida Southern College for my bachelor's degree, which was another private school. So I owe in total for all of my nursing degrees like $70,000.
And what was the payment on that?
Like $500, $600 a month.
But I mean, were you?
I deferred that payment until, because you can, as long as you're still in school, you can continue to defer. And so I only paid on that for a couple of years.
Right.
For a couple of years. Because I was working while I was getting my bachelor's degree. So I started paying that probably in 2013. Right. And yeah.
So it's exactly the road I want to go down. That I was able to
more than a car payment.
And so I graduated. We were just discussing this before we started filming. I graduated nursing school in 1997. You graduated in
2009.
Okay, so short period of time in that
Phi Theta Kappa.
In that short period of time, I was able to do this beforehand. I went to some college beforehand, and I went to music school in Los Angeles. So I was able to pay for all of that while I did it, or shortly after I did it. I think my biggest amount of money that I owed anybody was $20,000. Able to pay that off, no problem, while I was working afterwards or during. And this is a thing, this thing that I've seen happen, especially in the nursing world, where colleges jumped in from everywhere and made these really hard to resist offers. We'll get you in the program. We'll get you out of the program. You're going to be making great money. And boom. And I've seen nurses that walked out of these programs owing $100,000, which it's going to take them decades and decades to pay off. They're owing the kind of money that only would be seen prior to that by people who were lawyers and doctors owing that kind of money. And so it sets you up to have a really hard time to pay off, because with a $500 loan, do you know how much of that was actually going to?
Almost nothing.
Yeah.
But in between the RN degree and the bachelor's degree, I ended up getting divorced. My marriage did not survive RN school. I was a statistic, and I had a really crappy, awful divorce, lost custody of my son at that time, even though so I'm supporting my family. My ex-husband would not work, refused to work. I was supporting all of us. And then when we split up, because he managed to maintain the more stable household because he lived with his mom, I ended up losing custody of my son, even though I was working as a nurse in the pediatric department at Lakeland Regional Hospital and going to school to pursue higher education so I could better take care of my family. I still lost custody of my son at that point because trying to provide stable household, me and my daughter, we had to move around a little bit.
And how much money were you making at the time?
$21 an hour.
Okay, so
straight out of nursing school.
So approximately by the time you got your bachelor's, you're $70,000 in debt. You're making $21 an hour, and you're trying to survive with a family. Yeah.
I have two different baby daddies, so I also owed child support for my son while not receiving child support from my daughter.
Okay, and so And did you own a house at this time, or did you?
No,
Okay.
and uh sort of. While I was married, before I got married, I qualified for a Lakeland Housing Authority program where I got assistance in receiving like down payment assistance on a condominium.
Okay.
And what happened at that in that time is we had a bunch of hurricanes come through that year, 4 in a row, something like that. And they had to redo the insurance for the common areas, which caused the homeowners association to go up from $65 a month to like $400 or $500 a month within a year or two time span. So you're talking about my total mortgage payment almost doubled overnight.
Wait, so you got a mortgage?
It was a mortgage on a condominium. It was I was part of a because
Right.
I already had a dependent child. I qualified
And
for like a income assistance, low income
and was this one of those places
Keystone
that you
program.
couldn't like?
You can't resell it.
Right.
You
Right. Okay,
can't
that's
loan
what
it
I'm getting at.
out.
Okay.
You can't do
So
anything with it other than live in it. And if you don't live in it, you have to bankrupt it to get rid of
right.
it.
Okay. So to draw the picture
Couldn't
here,
afford it anymore.
this is the picture I'm trying to paint of what's wrong with what's going on, with things today. That in the same amount of time you're talking about, roughly after nursing school and working in your job, maybe a little less, but in a similar time frame, I'm out of debt, and we're talking just a decade earlier, or 12 years earlier. I go to nursing school. I'm out of debt quickly. I am able to bank money for my job. I bought a house that cost me, I think my first place that I bought in Wisconsin, in Madison, Wisconsin, was about $87,000. So cheap payment. I got a roommate. I basically, my roommate paid my mortgage, and so this is the point I'm slowly, want to build into, that I'm trying to make about like what's wrong with this picture when we're taking two exactly similar jobs. I mean, the pay around the country isn't that crazy different in most places. There's some places where it's higher or a little lower, but the averages are pretty close. So in the same amount of time period, if I jump a decade later after getting out of nursing school, I've got money in the bank, I got savings, I've got a 401k, and I own a house and that I've got equity in. In your situation, you get grabbed by one of these universities that uh, you know that you go to get your degree fast. It costs three times what it cost me, and the money hasn't really changed, and the money in nursing has not really changed that much anyway. I mean, it's not kept in line with really what, certainly what the hospitals
There
are
was a
making.
huge jump from East Coast to West Coast, though.
Right. Right.
They really, even with the staffing and the some of the what am I trying to say? Working conditions are much better in California than they ever were in Florida. But I
Mm-hmm.
digress.
Yeah.
Sorry. My eyes, my eyes twitching.
So so then, yeah, so all of this becomes pretty overwhelming then, right? I mean, it becomes you've busted your butt to become not just a nurse, a really high level nurse, pediatric trauma nurse with the certifications that go with it, working in the emergency department. That's up there. There's no doubt about it, and probably one of the higher levels of nursing that exists, and um, and so
Plus childcare, right? So you're
plus
talking about
childcare,
all
right?
these bills. So now I'm separated from my husband. I don't have access to my son, but I still have to pay for childcare for my daughter. I've got kids in two separate school zones because I lost that battle. Like I couldn't afford to live without a roommate in Florida,
Right.
and it was awful. It's
And
awful. I didn't have cable. This is one of the reasons I think I've never watched TV. I couldn't. It was a nominal thing that I could never afford.
right,
Trying to cut where I could cut.
right, right. And so, and the other point I want to make is I wasn't any genius. Um, I this all came pretty simply. I could make mistakes. I worked on and off different jobs. You know, I work some part time. I took a long stretch off to go on, you know, to just have a getaway from nursing where I did some other things. And just a short time later, you're in deep debt. And so, what are the, you know, not to make this a sad story that like, oh, right, because you don't feel this way. It's not woe is you on every level.
No, I mean, the nursing served me for as long as it did. If I would have kept at it and not quit when I did, I probably could have eventually gotten ahead of it. But I I I wanted to provide the house for my daughter. I retained custody of my daughter. I wanted the house with a white picket fence. I went to school. I did the thing, and I'm renting, and it's so expensive. I was the place that I was renting within a reasonable driving distance of the facility. I was working at Stanford at the time. It was $2,200 a month, and I got approved for a $500,000 mortgage. That wouldn't have bought anything in the Bay Area. I would have had to live in Manteca like the other nurses and commute. And now by this time, my daughter's 14. So what would I'm going to take out a $500,000 loan to put my daughter in a house who will eventually go off to college, hopefully herself, you know, and move out of the house. That's kind of when I had my little midlife crisis. And instead I thought, well, I'll get this RV and I'll do RV living for a while, and that'll be cheaper and it'll be different. And it's the solution, and it's just as expensive as renting or being in an apartment. It's just a different flavor of the same garbage. Then on top of it, you've still got association fees and things to worry about. If your RV's old, they won't let you in the park. Like it wasn't the answer. And then I found out about Slab City. And at that point, my daughter had decided she wanted to go live with her dad, who was back in our lives. And she was 15. I allowed it. And I took off to Slab City where I could park for free. If they wouldn't have dangled the home ownership so far out of my reach, if the things that I wanted wouldn't have been still so far out of my reach, I watched my coworkers who didn't have teenage pregnancies going to the Philippines for these long vacations. They were literally working to fund their adventures, and I'm barely able to afford my bills with no closer to my goals. You know, I have nothing in my savings. I wasn't going to play that game anymore if I'm losing it anyway.
I can verify. I mean, the other thing, you know, fill in my time being a nurse, I can tell the stress that would come to, and has come to, a lot of new nurses who went to these programs, got these big bills, had to pay off big student loans, and then the stress of being a new nurse. And so stress of being a new nurse, and like you said, so all of this compounded, and has compounded, if people don't know, to an enormous amount of people dropping out of the field early. You know, people who stuck around for a couple years, 5 years. You actually made it a long time. I mean,
it's a bummer too, because the nurses are leaving the bedside, and you've got nurses that are taking care of patients that they've maybe only ever heard of that disease process in a textbook. Right. You know what I mean? I remember the stats from nursing school, and it's bad. Mm-hmm. It's bad. You've got new grads touching you that have no business. Like, I just can't. I don't get sick. We don't go to the hospital on our days off. You know, don't ever go in the summertime.
And let's be fair to them too. They're busting their butts. They're doing the best
and not their fault. It's not their fault, right? It's not the nurse's fault.
Right.
It's but the hospital is a business, and if you think that the hospital cares about your health, they do not. They're a CEO, they're a corporation. Now, the individual nurses and the doctors and the staff, yes, they absolutely probably do care about you. There were nurses that were just there for the big paycheck. So I'm not going to say all of them, but overall, that hospital is a business. They care about the bottom line. I worked in the ER. It's a money suck. Right? People don't go to the ER for elective surgeries. They go to the ER on the worst day of their life, or they go to the ER because they can't afford to go get healthcare anywhere else. And so my department was notoriously understaffed and overworked, and they prey upon nurses' empathy. Work harder with less. You know, your patients are suffering if you don't. And not at the expense of my mental health anymore.
Right. And you made a really good video about what that cost you. And so now let's pivot a little bit. So it's like, basically, hopefully I've painted, or just by trying to ask you the questions that I'm interested in here, try to paint a picture of like how unfair this is and how it changed from when I went to nursing school and I graduated. I didn't know anybody who couldn't pay off their debt. That wasn't really never talked about. Most people, in just a short time before you're talking about when you went through what you went through, in my generation, uh, graduated, got a decent job, bought a house, got married, and that money was good money, and it changed in there. And that's the point I'm trying to make, is it changed, and it didn't change for the better, and it didn't change to benefit anybody. Doesn't benefit the patient, doesn't benefit the nurse, doesn't benefit your family, doesn't benefit the country that is in a nursing shortage. So hopefully you painted a picture of that. So pivot to the other interesting thing for me is that you end up here, and uh, a huge sense of relief, right? I mean, you did this thing that was supposed to make you happy, right? You went to nursing school to pursue something you were interested in. You're good at it. You're smart. You're really smart with it. Um, I can verify that from all the conversations we have about medical stuff. You're crazy smart, but you weren't happy.
Because again, I felt like, and maybe if I would have, I made poor choices in my relationship partners. Maybe if I would have found a dude that would have helped instead of hindered, right there for a while, I did have a good one, and then it didn't work out. But mostly, I picked up these deadbeats where I was carrying the weight of the whole family, and that's on me, right? But I never had the ability to just focus on work. It was all on my shoulders, right? I was a teenage pregnancy, and so the entire household fell upon my back. I had to make sure that my child was taken care of, that the household was taken care of, and the career, and it got to be too much. And then on top of that, with the things that I was trying to save up for dangled just out of my reach, I'm not playing that game anymore. I felt like I was losing anyway. I did the things that I was told I was supposed to do, right? You go back to school, you have a career, you can buy these things, a house, but it's a house it feels like it's a commodity, right? I'm a typical millennial. I'm a typical millennial.
Mm-hmm. Well, I mean, and that's like I said, that's the picture we're trying to paint, because somehow, I mean, I can hear it in your voice. Somehow it's like you almost feel guilty about this, that it didn't work out. I didn't have to work. I honestly, I mean, I've worked hard in my career, but I didn't have to work that hard to make it work out. It worked out.
Try to take ownership of my choices.
Right.
You know what I mean? And I did get
do.
pregnant at 17. I did have 2 kids really early. I did, you know what I mean? Like, I did continue to do dumb stuff with.
But $500 in school payments that are taken right off the top. A lot of people have much more, than that even. To put it in perspective, like I said, I think my house payment, a decade before you, after graduating from nursing school, getting a job, I only put down $5,000 to buy a house. I bought a little
Sure.
bungalow, but I think my house payment was around it was 700 something. So for $200 more a month and $1,200 less than you were talking about for an apartment, where you're living, I was owning a house and building equity, which I believe that house today is worth 300 and some thousand bucks in Madison, Wisconsin.
About the ghetto of Sunnyvale.
Right.
I mean, it was still Silicon Valley, so the ghetto wasn't really like the roughest, nastiest place, but the apartment was gross.
Right.
It wasn't like it was posh, not for the amount. I've never felt so poor while making the most money of my entire life. That's basically where I was at there. And how are you supposed to save when your rental payment is so high? If you can afford a $2,200 a month, if I could have been putting that into a house.
So no, that's perfectly said. You've never felt more poor than when you're working that hard and making the most money of your life. There's something wrong in that equation. And then that wrong translates into people like you that we've invested in, right? I mean, we've invested in as a society. You've got an education. We want you taking care of people. We want you doing that job. And this is the tragedy that needs, go ahead.
Oh, I didn't mean to interrupt you. I
No, go
just,
ahead.
when you were through, while I was working at this at Stanford, I wanted to go part time. Um, I thought that, not that it would have been the greatest with the money situation. I'm complaining about my lack of money and ability to afford things and talking about going part time, but for my mental health and for being able to raise my teenager at that point, if they would have allowed me to cut back on my hours some, I feel like I would have had a better work life balance and I might not have thrown the towel in. You know what I mean? Like,
Mhm.
I'm trying to tap out. That's too many hours. Let me dial it back some and show up a little bit less. And yeah, but that they won't let you
Right.
do
So
that.
you were trying to make some balance out of this where you're not killing yourself in the job and then stressed out at home. So it pivots to, um, to put a little spin on this and how it worked out for you. So I feel like you're probably underestimating how much stress you were under. That's just from sitting back here, it's a huge amount of stress. You were completely, really stressed out, and I can easily speak to the amount of stress that people I don't think gets relayed very well on, like, just the vibe. When you're a nurse, the difference between other jobs that I think other people don't quite get sometimes is most people leave a job and it's the thing that they've been doing. The thing they were doing that day is the thing they come into tomorrow. They come into that and they're like they're working on a project, or not to say that everybody doesn't have stress, but the unique stress that is especially in an emergency department
An
or in a hospital
understaffed
with nurse,
emergency department.
right? You walk in and you never know what's going to happen. You can have a day where you do nothing, like there's just nothing going on. Well, it happens. No, but I mean, bear with me. You can have a day where that's really relaxed. The stuff you get is not taxing, and you can get a day where from minute one of a 12-hour shift, you are going and you barely get to go to the bathroom, you barely get to eat, and when you walk out, usually the vibe is, you're leaving us with all this. It's not like where most people, and a 12-hour shift would be a day and a half of
Right.
work. A lot of times when you walk out, it's hey,
You
what if
didn't.
you forgot this thing?
Yeah.
And so, right, exactly. So that's where, so now you end up in Slab City. It has to feel like a pretty great thing when you first end up here.